Hi, this is Dr. Astruc, and this is the third of my frequently asked questions about bipolar type 2 series. Part 3 today, we're going to be talking more about how bipolar type 2 shows up in people's lives. And I want to look at three very common scenarios. Scenario number one is that because the highs, by definition, are not causing a problem, what people are most in touch with, and what in fact is the major part of the illness, is the depression. So what we end up looking at, and what people end up describing, is cycles of depression that are pretty paralyzing. Remember, depressions are characterized by not just a low mood, being blue, being sad, being down, but the illness of depression is associated with less energy, difficulty concentrating. Every little task becomes huge to do. Problems with sleep, either sleeping too much or sleeping too little. People have difficulty getting out of bed and going to work. There can be a significant amount of anxiety. There can be suicidal thoughts associated with this, loss of appetite or increased appetite. So there's a whole host of symptoms that we see with depression. And with bipolar type 2, frequently what people are coming into the office with is talking about their depressive symptoms and their depressive times. Nobody's coming in to tell me that there are times that they feel pretty good and get a lot of stuff done. That's not causing a problem. That's one presentation. Presentation number two is having high degrees of anxiety and insomnia. Oftentimes see this in people who have been started or treated with antidepressants. So they present to their doctor's offices saying, I'm depressed. They have the list of symptoms. Doctor puts them on an antidepressant, which is a reasonable thing to do if there's depression only. But what people will then respond to the antidepressant with is getting increasingly anxious, revved up, maybe more depressed, and having insomnia. The third presentation that we'll see is someone who comes in with a lot of irritability and argumentativeness, who's not typically like that. And this may be after having been started on antidepressants or before being on antidepressants. But what we start to get the history of from these folks is that they have periods of times when they're feeling pretty out of control. They're finding that everything gets on their nerves. They're getting into fights, argumentative. Nobody can tell them nothing. Everybody around them is walking on eggshells. And this is not their baseline. So this is something that occurs sometimes, but it's not someone who's always like that. That's another clue for me that we might be looking at something that's in the bipolar type 2 spectrum of illnesses. Thanks for your time. More to come.